wire with time, but I want to rephrase one of Bob's questions. Why didn't you know it, and when didn't you know it? Why didn't you know this was coming, and when did you finally realize that there was going to be a need to do this? I think Bob was talking about the long-term planning process, and that renovations were taking place in a facility that you're now talking about not using for this purpose. So I think that's a fair question of when did you know, and why didn't you know sooner?
We implemented the plan that was developed and approved with the Alliance coming together. There have been a couple of comments made. We are fully engaged with discussions with other providers, other systems, other physicians, other organizations that are involved in healthcare. As was pointed out, that's critical going forward. We cannot be a standalone in this world. So we want to be the best partner to each of those different entities. Strategic partnerships are a critical factor for us going forward in a variety of different ways. So we're actively engaged at all levels in that regard. So we're looking to attach and to be a part of. So the integration that you're talking about, absolutely 100% agree with, and we are doing what we can to be sure that we do engage in and with others to support the care. So
The other question was
when?
When did you know?
As part of that process, the first year we were, as Cynthia described, very successful. We didn't feel the effects of the recession until the latter part of '09. It occurred in '08. It was at that point that we started seeing the changes in the industry, the changes in legislation, the changes in the structure of healthcare, the preparation for the Obamacare. All of these indicators we started looking at 2.5, 3 years ago. And as it evolved, the industry's been involved in these discussions for years. Much of what had been on the planning blocks for many years actually is taking place now. So we began to see this 2 years ago, and it progressively got more intense.
And how does that relate to the timing of the improvements at the Kingston Hospital facility that you're now talking about not using?
That was part of the original plan.
Right, it was part of the original plan.
And was appropriate at that time in the market, given the conditions of the economy and the healthcare environment.
So that preceded the determination that the two-campus model was not going to work? Those commitments were made and those improvements were done before that determination was made? Pat Stedge is our next speaker.